In this video, I'm going to talk about people that drink alcohol and what medical and psychiatric problems may come up where they need to see and get treatment by a psychiatrist. Now, I know that not everybody who drinks alcohol ends up getting medical or mental health problems as a result, but unfortunately, many people do, and it's something that's really important and does need to be addressed. Every day, about 385 Americans will die from excessive alcohol use. About 3 million people worldwide every year will die from drinking alcohol. About 10% of deaths from people ages 15 through 49 are alcohol related. Now, first of all, I'll talk briefly about some of the reasons why people may drink alcohol. They may find that it helps in social activities. It may help them calm their thoughts or help them relax a bit. Maybe they use it to wind down after work or after a long day. Some people also use it to help with sleep. There also may be some health benefits from it. For example, it's thought that maybe it can increase the healthy cholesterol a bit and decrease the unhealthy cholesterol. So the typical guidelines for drinking are no more than 2 drinks in a day for a woman or 3 drinks in a day for a man, particularly because how the body is, the metabolism of males versus females. Males are usually heavier. And the drinks meaning it could be like equivalent to a glass of wine, a shot of liquor, or 12 ounces of beer. And so for a woman, it's no more than 14 in a week, or a man, no more than 21 a week. And those are just recommended guidelines. So what happens is we see often that people, at least in a medical or psychiatric setting, they will tend to drink more when times are stressful or times are rough, because it's a habit that they formed over time. They learned that alcohol helps calm down their mind and their body. And so if things are difficult or stressful, they're going to resort to perhaps drinking more alcohol to calm that down. And then over time, it just becomes an addiction. The brain pathways take over, alcohol binds on or activates through the addiction pathways in the brain. And then eventually, for many people, it's really hard to stop. And so this video I'm now going to talk about some of the problems in different organs of the body that alcohol can cause. So first of all, I'll talk about the heart. The purpose of the heart is essentially to pump blood throughout the body so it goes into the various tissues and organs, giving it oxygen, taking out carbon dioxide, allowing people to move and breathe and function properly. So what happens is over time, alcohol can damage the heart, enlarging it to an abnormal size so that it actually will not function properly. It will not pump properly. And when the heart does not pump properly, then the blood is not going to easily get past through the rest of the body. And it can cause people to get easily fatigued or easily tired, may decrease their exercise levels. In fact, it can lead to a condition called heart failure, where the heart is just not pumping properly. Fluid will build up in the body, and it just really limits someone's activity level. Also, when the heart is enlarged, it can increase the chances that someone has a cardiac arrhythmia, also known as basically a heart attack, and people can die suddenly from heart attacks. Next, I'll talk about the liver. The liver has various functions in the body, but in short, it helps to clean out some of the toxins that develops in the body over time. It also helps with the metabolism of some of the medications that people may take for various conditions. And so alcohol damages the liver over time. In fact, initially, if alcohol is stopped, that liver damage that happens can go back to normal, and so they can function normally. But if alcohol is done repeatedly or a long enough time or for severe amounts, that liver damage cannot go back to normal, and those liver cells just die off. And that can actually lead to liver cancer, or it can lead to various types of liver failure. And just like how the heart, if it's not functioning properly, will build up fluid in the body, same thing with the liver. If the liver's not functioning properly, that can lead fluid to build up, and it can actually damage some of the other organs in the body. Also, it can make the medications that people take normally for their conditions, they may not function as well or may not function properly because the liver oftentimes can be needed for those medications to function properly. And it can really just be a deleterious, almost like an exponential problem down the road because the liver is failing. There are possibilities of liver transplants, but typically if someone is addicted or still drinking alcohol, they're not going to qualify for a liver transplant. They're rather going to save that liver organ for someone who is not addicted to alcohol, because the alcohol is just going to damage the new liver that they place. Some other organs that the alcohol will damage is the bone marrow. And so the bone marrow functions for a few various reasons. It helps generate inflammatory cells. It helps like cells that fight off inflammation. It helps generate blood cells, and also helps generate platelets that will help stop bleeding if bleeding would occur. And so over time, the alcohol can damage the bone marrow to where the bone marrow cannot produce these different cell types properly. It won't produce enough blood cells. It won't produce enough inflammatory cells. It won't produce enough platelets. Therefore, people are more likely to have medical problems as a result of their bone marrow not functioning properly. Lastly, but certainly not least, I'm going to talk about the brain. Now, the brain has so many different functions in the body: walking, talking, a lot of the natural movements. So over time, alcohol can damage parts of the brain to where it affects someone's ability to walk. It affects someone's ability to think, to urinate, to do various functions. Oftentimes, people will get early signs of dementia related to alcohol. Maybe people will confabulate or lie because of the damage that alcohol does to the brain. People can also get many psychiatric problems because of alcohol. We said that earlier, alcohol is a depressant, so it slows down the mind and the body. Well, alcohol can actually cause depression in itself. Also, alcohol is a depressant, so it slows down things. But when there's no alcohol in the system, when there's symptoms of alcohol withdrawal, that can actually have the opposite effect and lead to more anxiety. Not just anxiety, but can lead to shakes or tremors. It can even lead to seizures, depending if someone is drinking a lot of alcohol or not, or how much alcohol one is drinking. Sometimes we see people develop psychosis or impairment in their ability to understand reality because of alcohol. We just see there's so many emotional problems that come from it. Many times people develop mood swings or anger episodes. I'm sure you're aware of people driving drunk or getting in fights because of the alcohol-related side effects. Oftentimes, we see people in the emergency room or in the crisis psychiatric center who complain that they're having suicidal thoughts or wanting to take away their life, but really they are lost their inhibitions that alcohol has done. Maybe they've gone into an argument, or they've just felt very down, isolated, depressed, and that while intoxicated with alcohol, they may actually make a statement that they want to end their life, or they may actually do an attempt. And so hopefully it's just a threat and nothing serious, but sometimes people actually act on the thoughts or the threats, and it just can have long-term consequences in their life that they just didn't anticipate. Also in the brain is the respiratory center, which is what controls the breathing, and alcohol can slow this down so that people may find it more difficult to breathe, and that's often a source of how overdoses happen when alcohol is mixed with other depressants like opioids or benzodiazepines, because they work together to slow down the breathing. These are just some of the common things that I see in a psychiatric setting from alcohol-related use from my time either in the emergency room or in the medical hospital setting or in the outpatient clinic. Alcohol is not easy to treat. There's not really any medications in itself that's going to treat alcohol. Medications can help maybe with the cravings or decrease a little bit of the high, but it takes really a lifestyle change. It takes a supportive network. It takes a lot of help to stop with alcohol. In fact, the most effective way that we know of is the 12 steps meetings, Alcoholics Anonymous meetings. So the earlier someone addresses it, the better it is. You want to develop healthy coping skills or healthy patterns of behaviors to deal with stress or life difficulties, or to deal with socializing or deal with sleep. You don't want to use a drug like alcohol, which you can get addicted to over time. Hope you enjoyed this video and benefited from watching it, and hopefully it'll help prevent from alcohol problems later down the road.